Hi, I'm Cheryl Kagan, very proud to be the senator for Gaithersburg and Rockville. School just started recently, and it seemed like the perfect time to kibitz with one of the key leaders of the Montgomery County Council of PTAs, Parent Teacher Associations. With me today is Laura Mitchell, the Vice President of Advocacy. Laura, thank you so much for your leadership and for taking the time to chat.
Thank you for having me.
Absolutely.
I'm excited to be here.
Good. Well, there's so much to cover because back to school, finally in a quasi post-COVID-ish time, is such a relief and so important, but there are obviously so many challenges. I'm going to try to cover as much as we can. So let's start though with your background, because you were an elected official and you used to live on the Eastern Shore. So
I was.
You lived in Wicomico County and you served on the Salisbury City Council from 2011, 2016. Talk about running for office and serving.
Well, it was very different. I was first elected to the Central Committee in Wicomico County, and just the deeper I got, the more I felt like I needed to do more. I always said, if you don't vote, you give up your right to complain. And I realized, well, if you could do more and you don't, it's no better. So we had some issues on the council that I wanted to address. And so I ran for office and I won. And then I was like, now what, fool?
Now what? So you left because your husband got a job in Montgomery County, and you always say you have to put family first. And so you followed your husband, and talk about the transition from Wicomico County to Montgomery County.
It was different. He moved up about 6 months before I did because I had my hands in all those things that elected officials get into.
Yes.
From zoo commission to airport commission, and we were raising our granddaughter and finishing school and doing all those things. So he moved up in April and started the job, and we came in August, and just in time to start school here. It was a transition, but it was a good one. It was good timing for our family as a whole. And we love Montgomery County. There are a lot of perks to being here. Being foodies, that's a great one. There's lots of options here.
There you go. And this was in 2016. So yes. Your granddaughter is in what grade now?
She's entering 10th.
Wow. Okay. Growing up.
Yes.
So your background is in accounting. You have an MBA. Talk about what you feel like you bring to PTAs and the importance of serving in PTA, in parent-teacher leadership.
Yeah, so she started the first thing I did was join the PTA at our school. I noticed they needed vice president of fundraising or something. It was the position they had open, but I didn't know anybody here and she didn't know anybody in the school. And I thought, well, that's how we'll connect. So I did that, and we have connected and stayed connected through that.
This was in the Wheaton cluster, right?
No, that was actually in Gaithersburg cluster. That was at Rosemont Elementary.
Nice. My district. Yeah. Okay.
Yes. So, because we live in King Farm, she ended up in the DCC through School's Choice. So that was a great move. I've been active with the PTA, and I've learned so much because there were a lot of things that she has a lot of needs that I wouldn't have known how to address if I had not had those contacts and those people in the PTA and in the leadership to ask. But within 3 weeks of joining, I went to the training and got recruited to chair the operating budget committee for the PTA.
Right.
And so I'm still doing that. We're about to start another round. And the accounting does come in very handy there. And having served in an official capacity, an elected position, you understand those balances and that, trying to keep that balance. But I'm able to I read a budget like a novel, right? You could tell me whatever you want is important. If you don't fund it, you're not showing it.
Amazing.
So
yeah, good.
So it's really helpful that way.
Yeah. Let's talk about coalitions and collaboration. So we have a fairly new superintendent, Dr. McKnight, and we also have new council members coming in. How does the PTA collaborate with each of them?
Well, I have been working. One thing that we've done, we've got a grant from National PTA, from the U.S. Department of Health and Human Services, to support vaccine clinics. And we've been doing that since January. It was supposed to last a couple of weeks, and it's still going. And looks like we might get some more for the new variant. But as we're doing that, we're building relationships more than supporting the clinics. I'm working with people from MCPS. I'm working with elected officials and talking with them about, what the environment's looking like, and following briefings and things. So you get to build those relationships. Sometimes it's just on one project, and then it expands into many, many other things. And I serve on one of the county's advisory councils that in the PTA seat, because they have certain designations for seats on those. So
Yes.
I was able to work on passion projects of mine around mental health and substance use because of that connection with PTA and the government. And, so I've worked closely with MCPS, and we have rolled out a number of programs since January, just brainstorming at those clinics.
Right. So we're going to get to some of those issues, but talk, if you would, generically about some of the PTA's top priorities for this school year.
We're just starting to work on our advocacy priorities, but typically they are communication. It's at the very top. We need to know what's going on. We need to know the thought processes behind what's being rolled out. You get a lot more buy-in and a lot more cooperation that way. So communication, safe routes to schools is really top of mind. Again, that kind of wasn't so important when we weren't going to school physically.
Right.
But now we are seeing, obviously, with the last couple of days that it's extremely important.
Sure.
Mental health and substance use prevention, huge issues right now.
Right.
We have a lot of students that are really struggling.
Yes.
And, just being safe in school.
Yes.
All around.
So talk about, people talk about the W schools, Whitman and Winston Churchill, my alma mater, and Walter Johnson and others. There is geographic diversity that goes with socioeconomic diversity and ethnic diversity, language diversity, all that. How does a countywide organization that is looking out for all students navigate some of the have more and the have less folks?
It is interesting, and it does sometimes create a different conversation than where you thought you were going, because we are a member organization, member driven, member votes count, and it's a very democratic process in what we do moving forward. But some people don't have the same priorities. So when you have one area of the county who doesn't have water filling stations, or doesn't have they have leaky roofs, or they don't have cameras at their vestibules, and the others have all of that.
Yes.
It's sometimes a little more challenging to get that consensus, to build that consensus. And it's really all about education, and sometimes inviting people to go and talk with, or go and see some of the schools that don't look like their schools, or don't have all the amenities that their schools have. And understanding that.
Do they visit other schools so they have opportunity?
Yeah, we'll try to set up, like, if we're having an area meeting or something, we'll do it at one of those schools. Right. We've done that in our summer area meeting, so that people can see what others are talking about. If they're not experiencing, they have to see it.
Right. Definitely. I left out Wooten, which is in my district, so I don't want to leave out Wooten.
Yeah, don't leave them out.
Right. The Kirwan Commission, the 10-year blueprint for Maryland's future public education, is something that my committee, my chair, and I, and the rest of the General Assembly worked really hard on, and it was a multi-year effort. Why don't you talk about how that's actually being incorporated and how you see it impacting Montgomery County's public schools?
It's not really rolled out. It's been a little delayed, obviously. So we're not seeing a whole lot of the rollout yet. How I envision it working is fantastic. How it will work, I'm sure there'll be hiccups, like everything. There'll be things that we didn't anticipate, or things that we miss the mark on, that we have to go back and rethink. So it's important to have, like you were mentioning, those connections and relationships with legislators who would have to change that, because this is the law.
Yep.
So I think that it's going to be very beneficial for our students and for our staff. We know that we have staffing issues everywhere, and that's a nationwide thing. It's not just Montgomery County. So I think that will help. I always say teachers don't teach for the income, they teach for the outcome.
Right.
But they still have to feed their families.
Right.
So we have to be aware of that. If they may leave the profession because they have to survive, not because they want to. So we want to make it both possible, that they're able to do what they want to do, and that they're able to take care of their own families.
Yes, of course. So I don't want to be too political and too partisan in this conversation, but to be clear, Republican Governor Larry Hogan vetoed the 10-year blueprint, and we had to rework it. And that was one of the reasons for another year's delay. But hopefully my candidate, Wes Moore, will be our next governor. And I think we are going to be off to the races and really amping things up. So Maryland used to be top rated in the nation, and we have just been sliding. So any thoughts as to what you think would be top priorities and make the difference?
I would have said technology pre-COVID.
Mm-hmm.
I think that we had some catching up to do. We probably still have some, but putting a Chromebook in every child's hands is important.
Mm-hmm.
There is a balance to be had. We can't do everything online, screen time all the time.
Right.
It is not great. We need to balance that. But our students, when they graduate, they have to be computer literate. They have to be able to navigate the electronic world and the web and all of that. They can't, and even programming, so whether it's graphic programming or accounting programming.
Yes.
They've got to be able to navigate that.
Right. So tech literacy for sure. And I'm just going to put the word in on literacy, ability to write and research and be able to discern the difference between phony baloney stuff online and valid, credible sources. So some of that is critically important.
Absolutely. Raising students who are aware of the world and the way it really works, and not the way someone wants it to work.
Yes,
in touch with reality and able to determine what is real and what is not is critical.
Absolutely. Let's talk about language access. I've passed 2 laws requiring language access, that all state government websites need to be able to be translated into languages that people speak in Maryland and in Montgomery County. Talk about some of the challenges in our schools.
I'd say the biggest challenge is that we have 151 languages spoken in Montgomery County.
Yep.
That's a lot of translating. We tend to translate documents and information. I was just in a meeting about Mental Health Awareness Week, and the videos, and getting those translated, or getting interviews with persons who speak other languages so that they're accessible. And it's challenging. Mm-hmm. It's really very, very challenging. Mm-hmm. One of the great things is making sure that the websites translate, not just state level, but every level.
Yes.
So MSDE all the way down to
the Maryland
my neighborhood
Department
school.
of Education, MSDE.
I'm sorry. Yes. Yes. All the way down to my neighborhood school.
Yes.
That I can go on the website and I can, people can read what I'm writing. But another key piece of that is PTA is the connector between the school and the home oftentimes.
Yes.
And we don't have that advantage unless we can find a parent who will translate for us.
Yes.
Who then doesn't really get to participate in the meeting, or we use member funds to pay for a translator. Mm-hmm. We don't get that access through our schools all the time.
Right.
And that's really challenging. How do you connect with people who don't speak the same language?
Right. So let's talk about recruiting diverse people into the PTA. Traditionally PTA has been women, mothers, of young kids. And then once their kid ages out, they sort of graduate and move on. How do you get men? How do you get more people of color, people who don't speak English, and really represent the diversity of our county and our county's kids?
Yeah, you hit it on the head. If you know the answer to that, please share.
Abracadabra. I'll
right.
One.
It is something that we are very focused on, particularly this year. That is a big focus of ours. And I think it starts by knowing who is and who is not at the table. So we want to do a survey of particularly our board members and our delegates that are coming from all the different schools to see who we have at the table. And then we can see who is not at the table and make those targeted efforts. We have at least 3 PTAs in Montgomery County whose entire boards only speak Spanish.
Nice.
So we're trying to, I translated the financial training for board members into Spanish for them. We're working with some different avenues, trying to make sure that our board meetings and our delegates meetings are translated. We have the Zoom account that we can, which has been wonderful. We can have the simultaneous translation instead of doubling the time of the meeting.
Yes.
And we do allow our PTAs, our local PTAs, to use that. So if they have a high mix of languages, they can do 5-6 language translations if they have someone to translate it for them.
Great.
It also will do closed captioning. So we're doing things like that and looking at who is and isn't at the table. The other thing is looking at different activities and looking for ways that might engage more men, might engage more people of color or from a different neighborhood that's not particularly active, or a different cluster, I should say, that's not particularly active.
Right.
Like safe routes and clean air in the schools, the air quality. Those are things that the men have flocked to.
Okay, good. That's great. There's so many more issues. Let's talk about the returning to school in a slightly, again, I'm always cautious about how to talk about COVID. You know, it doesn't feel like we're post-COVID, obviously.
No,
but
no.
Talk about
Emerging.
how safe you feel like teachers, staff, and students are in the schools, and whether the PTA is weighing in. And then fundamentally, are all schools using the same guidelines, or does it depend on the principal and the local cluster?
I think the overall message is masking is optional.
Right.
There's no mandate for vaccines for students. There are some things that I personally would be more comfortable if we did have, because I'm a high risk person. And there are a lot of people that are high risk themselves, or their children that are going into the schools are high risk. And there aren't a lot of choices outside of that.
Right.
So how do we navigate that? Yes, one-way masking is somewhat effective. Two-way masking is more effective. We know that. But beyond that mandate, those have come down. So now we're looking at things like the indoor air quality, air filtration, upgrades to the HVAC system, the heating and air conditioning systems. And we really have gotten some leadway or some movement with MCPS on that. And they're looking at those portable filters and the monitors to look at where we are.
And just if you can speak to is it one size fits all, or is it different in every cluster or every school?
The guidelines are one size. The implementation or the tone that is set, if your principal's walking around wearing a mask and your admins are wearing a mask, your students are probably masking, or more of them than not. If they're not, then you probably don't have very many masks, except for the people that are very high risk.
Yes.
The students that are high risk. So it's both. it's a one size fits all blanket statement that's wide enough to embrace what's going on, let the schools embrace what's going on in their community. But that is driven by, the leadership behavior.
Right. That's kind of what I guess. So let's talk about substance abuse, mental health. Let's start with let's do both of those. And let's talk about 988, which I'm really glad is behind your head here. As you probably know, I've spent the last 7 years working on 911 to make sure that we can save lives and upgrade our technology and stuff in emergency when people need police, fire, and paramedics. So 988 is kind of a first cousin. It was rolled out in July of 2022 nationally after a lot of setup, but not everyone's fully ready. Why don't you talk about 988, and then we'll shift to depression and substance abuse.
So 988, I think will be fantastic. It already has. We expect it to triple the number of calls that we get at our crisis center, which was already very high since COVID began. Everybody struggles with something sometimes. Some people can get through it more quickly or more easily with others. Some have better supports around them at home, and some need outside help.
Yes.
And that's what this is about, is making sure that it's a compassionate crisis response not a police response
Yes.
from people who are trained to do something very different.
Yes.
You know, and they're trained to do what we need them to do, but they're not trained to do this. And they were asked to do this for many, many years.
Mhm.
And we've had some situations because of that. So 988 is great. We didn't get all the funding that we had hoped for, about half, I believe. So some of the push out for information and the advertisement and all of that has been dialed back some, and we're all trying to promote that with things like this even,
Yes.
and start that conversation. Well, what is that?
Yes.
And knowing that it's talk,
Talk,
text, or chat. Yeah, that was easy for me
Yes.
to say.
Yes.
Is really important, because some of our
Mhm.
youngest students are that are struggling and really need to talk to somebody. They're not going to call. They'll text,
Mhm.
maybe from the bathroom at school.
Mhm.
And that's, I think, an opportunity for us to put that in all of our bathrooms, so that, because
Yeah.
that's where they go to hide. Put it
And
in those places they're going to retreat to.
yes, to be clear, 988 can be a suicide hotline, but it's also, you just need someone to talk to. You just need some support. So it doesn't have to be as dire as that. But if you need help, reach out.
Right.
Let's talk about substance abuse. How did you get involved? Because you're such an enormous leader on this issue. How did you get started?
An unwilling participant, I will tell you. I discovered that my youngest son was in active addiction, and I remember it like I remember 9/11, when I figured it out. And I know that there were signs and things that I saw, but I didn't know what I was looking at. So it's my mission to make sure that other parents are not just knowing what they're seeing when they see it, but are looking, not in a snooping way and a suspicious way, but their eyes are open, they're aware,
Yes.
so that when they see it. And so I knew that I couldn't walk his path for him, but I could make sure there was one, and I could make sure the weeds were kept down to a minimum, the barriers, so that he could find it. Right? You can build a path, but if you can't find it, it's still not much good.
Yes.
So that's what I continue to do, is
Yeah.
keep improving that path, towards, making it an interstate highway, that it's really easy, and it's not hidden. And stigma is one of those things that is a huge barrier.
Yes.
It's a noxious weed. You continue the
To
analogy.
continue the analogy. So we just had International Overdose Awareness Day and opioid. I'm not getting all the names right, but the opioid overdose day. And so why don't you talk about what government is doing, as well as what the nonprofit sector is doing that can make a difference?
So yes, International Overdose Awareness Day is to really help elevate that conversation to people, reducing the stigma and remembering with love and not stigma, but elevate that conversation to parents in particular, that it can be your kid. Those three most dangerous words, not my kid. It
Yes.
can be.
Yes.
And it doesn't have to be a substance use disorder to get there. It could be the very first thing they try that's fentanyl laced or fully fentanyl, and you've lost them.
Yes.
So it's conversation that has to happen at every level.
Yeah.
And government has done a lot in promoting that. I do have some concerns that most of our focus, rightly so, has been, and funding has been, on opioids. But there are other substances. There are methamphetamines that are your ADHD medications. There are, there's still cocaine. It's still around.
Absolutely.
Yeah, benzodiazepines, the sleep or muscle relaxers or sleeping pills, those kinds of things. And if someone has been taking them from the medicine cabinet of their house or their friend or something, and they can't get them, and they see something that looks just like it on the street, they may, get it from a friend, and they have no idea what's in it. So it's those messaging and the talking about it, and using language that is not stigmatizing and getting in the way of people asking for help or giving that help. Substance abuse is not an appropriate term. We try to use substance use, and talking about, we don't use language. We talk about addiction, but we don't call people addicts. We don't talk about clean and dirty urines and things like that. It's those things that make people feel less than human and less than deserving of recovery. So September is all about that, and Recovery Month, celebrating recovery, encouraging people who are still in need of recovery
Yes.
to go for it.
Yes. So I was really glad that I was able to participate at the event, and there were booths by different nonprofits and service providers, and there were so many options. So if people missed it this year, they should watch out for it for next year, because there really are a lot of resources, especially in Montgomery County. And thank you for your leadership. You moderated and greeted and helped yesterday be particularly meaningful. So thank you for that.
If I could just add one thing on that
Please.
real quick. We do have a lot of resources in Montgomery County. Not a lot of people know exactly where to find them. We need to
Yes.
do a better job of making them obvious. And we don't have very many resources for youth. And we have plenty of youth who have substance use disorders, and they don't know where to go. And then there isn't a lot of options. There aren't a lot of options.
So 211 could be a good resource for getting information on human services, but 988 as a backup. I mean, there's so many, and I'm working on a statewide 311 to navigate government, but there are resources in addition to searching online. I'm curious, Laura, about the cannabis legislation that's going to be on the ballot. Do you have thoughts about that? Do you have concerns as to assuming that recreational cannabis passes and is implemented in Maryland? What are your thoughts? What have you seen in other states?
Actually, I look to other countries and what they've done. Norway and some other countries that have totally decriminalized substances, drugs, because then the focus is completely off the criminal aspect of it. And it really takes that black market piece away, and it cuts out a lot of the people that are trying to make it better, stronger, which is really just killing more people. And it puts the focus on treatment.
Yes.
Some safe use sites, some fentanyl strips, the harm reduction pieces, all of that. They focus more on that and less on the legal part of it.
Yes.
And Montgomery County does a better job than most counties in Maryland. But as a state, we really need to look more at that. We need to, obviously there are some that are just there to make the money, and they're a detriment, and they really do need legal consequences.
Sure.
I'm not saying that that's not something, but for someone who is in addiction, in active addiction, the law is not going to help them.
Yes. So I should just mention, unrelated to cannabis, going back to fentanyl and opioids, it took a while for me to get Narcan, naloxone to keep. And so I've been in conversation about how to make that more accessible, but we are running out of time. And so Laura Mitchell, Vice President of Advocacy for the MCCPTA, fast five quick questions with quick answers before we wrap up. First, what was your favorite subject in school when you were growing up?
Math, absolutely.
All right. Question 2, who is your shero or hero in politics and public life?
Oh, I'm going more local. Cherie Sample Hughes.
Okay, nice. Okay. Delegate from the Eastern Shore,
Yes.
Wycomico County. And okay.
Speaker Pro Tem, yes.
Speaker Pro Tem. Question 3, if you had a magic wand and could get any one policy changed in our state, what would you do?
I would make insurance, or make parity and equity enforced. I would have that enforced so that insurance companies had to cover substance use and mental health treatment equal to any other health issue, and they find every way around it. I would fix that.
Question 4, what's a hobby or a practice or something that you picked up during COVID? Something that makes you happy and is unrelated to the PTA?
Oh, I didn't have time to pick up any new habits during COVID. There was a lot going on, and
what do you do in your free time?
Sleep. That is sleep and walk. I do enjoy that. Some swimming, but I'm an overachiever.
Okay. Sleep and walk,
last.
but not at the same time. Not sleepwalk.
Right. No,
Okay.
not at the same time.
All right. And the last question, Laura Mitchell, what is your hidden secret superpower? What is a skill or talent you have, something you're really good at that most folks can't do?
I think I could put pathways together. I can find ways that others can collaborate or that we can collaborate and see how they fit together almost instantly, and to be able to bring that to fruition, because I can explain that vision and they like, nobody ever thought of that.
Good for you. That's valuable. Well, you are in the right job, and we are so lucky that you moved here from Wicomico County. Laura Mitchell, thank you for your leadership, your commitment, your advocacy with the Montgomery County Council on PTAs, and we appreciate your standing up and speaking out on drug abuse, drug use and addiction, and mental health and student education. Critically important. Thank you for everything you do.
Thank you.